There are many options. What procedure is chosen depends upon the deformity that presents itself. In many cases, there is significant drooping of the tissues of the face, so the face has to be tightened, and that can be done surgically by a procedure known as a face and neck lift. There are non-surgical techniques that do tighten the skin somewhat. A good example is something called Ultherapy, which uses high-energy sound waves to cause tightening or shrinkage of the skin. There are other non-surgical techniques that are applicable in people who just have deep lines rather than a significant droop to the tissues of the face. And in those patients, something called fillers is utilized. This is a chemical injection placed in the deep folds or lines, which help to fill these folds and improve one's appearance. This could be done with fat, it could be done with chemicals called hyaluronic acids, it could be done with several different materials. But basically the goal is to fill up the hollow areas or the lines in the face. What we do is, through incisions we make around and within the ear, and often under the chin, what we do is we separate the skin from the underlying muscle and the lining of the muscles. And then we tighten those deeper structures by suturing them in the appropriate vector, an appropriate direction, so as to give a lift to the neck and the face. And then we remove the excess skin and close the wounds with tiny little sutures, which are placed in such a way as to give the best possible scarring. The procedure is quite effective. There are many variations of the procedure, and your surgeon should be experienced in all of the techniques, and he will go over the procedures with you, and the two of you can make a decision as to what type of facelift you should have. The age varies tremendously. I have operated on people in their 30s who have premature aging, and I've operated on people in the early 80s who are young and vigorous for their age. More important than the age is how they are health-wise. The chronic age, the actual number of years, is not as important as the general health of the patient and the level of everyday activity that the patient indulges in.